my name is Divyanka and I'm a PharmD candidate. Today we're going to talk about the importance of taking your medication on schedule. Now, in the medical world, this is known as adherence. You're most adherent to your medication when you take it every time you are supposed to take it. This is the best way to get the most out of your medication and allow the medication to do what it's supposed to do in your body. Usually, if you're not adherent to your medication as per your doctor's recommendations, you might experience more side effects because you're taking the medication more intermittently and your body is just not used to it. This is also why it's very important to be adherent to your medications so that you're not experiencing those negative side effects. Most of the medications that you are prescribed, you're taking at home, and so you're not going to the clinic to get it every single time. So it is your responsibility to make sure that you're being adherent to the medications that are given to you so that they are allowed to work in your body as they are supposed to for what they're meant to treat. Now let's dive into it a little bit more. Why is adherence important? Again, how you take your medication and when you take it is very important in terms of the medical treatment. These medicines are designed to release a certain amount of medication over time into your body. And so again, it's very important to keep that on a schedule if the medication is meant to be taken on a schedule. When you skip a dose, that amount of medication in your body is then decreased, and you might experience a number of effects because of that. On the same note of skipping a dose, it's very important that when you do skip a dose, you don't double up on your dose. You can never think that, oh, I skipped one dose and so now I'll just take both pills or twice the medication that I was supposed to and make up for it. That will, again, really hurt your body even more because you're giving your body double the dose that it's supposed to be given. And if you've been on a schedule, that'll really mess with how your body interacts with the drug. Again, this is very drug specific. That was just an example, but that is something that you want to look out for, and you never want to take double the amount that you're supposed to take. This is important for all medications, but for cancer medications specifically because all of the different medications have very specific nuances. So if you have any clarifying questions, do ask your pharmacist, do ask your doctor, and fully understand how to take your medication so that you take it exactly as directed, and so the effect of the medication on your body can be as it's supposed to be. In addition to the medication that you've been given to treat the cancer, to treat the disease, it's again very important for you to also take the medication that's given to you for the side effects, whether it's for nausea and vomiting, whether it's for the headaches that you get. Especially for cancer medications, doctors do prescribe medications for the side effects so that you experience them less. So again, it's very important for you to take those medications, otherwise you will experience those side effects, and that will probably not be a positive experience for you. And a lot of patients, when they do experience those negative side effects, it really turns them off to take the medications in the first place. But those medications are really helping you to treat you, and so it's very important to stay on top of, again, all of the medications that are prescribed to you. Now, of course, there are nuances to this. There might be medications that you are prescribed on an as-needed basis, and those you may take as you need them, so you don't need to be on a schedule. But again, for the medications that are on a scheduled basis, you want to make sure that you're taking them right when you are supposed to. I know that we're all human, and sometimes we all forget to take some medications, we miss a dose. Things like that do happen, but again, try your best to stay as adherent to your medications as possible. The last thing I want to mention is make sure you have a good relationship with your pharmacist and your doctor. Make sure that they know you, and maybe even make sure that you have them on your speed dial so that if you ever have any questions, you can really reach out to them as soon as possible and get the answers that you need to, again, take your medications like they're supposed to be taken to help you treat you. Your pharmacist and your doctor and your whole medical team is there to help you, so do use them as a resource and ask any clarifying questions that you may need to. We hope this video was helpful. If you have any additional questions, as always, please don't hesitate to reach out to us. You can email us or visit our website, and we'd be happy to answer any questions you may have.